There's been a lot of terms bandied about with healthcare reform. Here's a couple: accountable care organization and medical home. An accountable care organization in theory would consist of primary care physicians, hospitals, and conceivably other parts of the continuum of care: nursing homes, assisted living, home health, adult medical day, hospice. In fact, I talked to a hospital administrator last week was saying perhaps they should be in the nursing home business if they're going to be responsible for the quality and the cost of care to a given population, which is what an accountable care organization would be responsible for. A subset of that is a medical home, led by a primary care physician who provides you with comprehensive care for your lifetime. Now, of course, there's pitfalls cited with all this. There's predicted to be a physician shortage. In fact, today I even read there's going to be an administrative shortage of leadership because the boomers are retiring from these positions. The cost to make this all happen. Antitrust issues with referrals in a somewhat closed system. But I want to step back even further than that. I spend literally hundreds of hours talking to physicians in the strategic hospital work that I do. And you know what? No doubt, these are talented men and women, great skills. But there's a whole other soap opera going on along with it. You know, I find that physicians who are in their own practice don't communicate with each other, compete with each other, maybe don't even like each other. They hold grudges against administration. They're immature sometimes in how they act. Specialists who don't refer to primary care physicians. And all the while, this is supposed to be a group that gels into an accountable care organization, let alone bring in the other disparate parts, nursing homes, assisted living. So I said, well, maybe if a hospital did get into all these businesses and owned it, it would be better. But you know what? You still have cultural issues, integration, politics, referral patterns still be the same. Administration paralyzed to do anything in fear of losing admissions. So how can we make this work? Well, I think we need to take some lessons from Apple CEO Steve Jobs. Really. Look at the way he develops products. You know, when we develop products, we're about putting as many features into them as possible. Hospitals providing as many services as possible. When Steve Jobs designs something, and it's his vision that really leads it, he creates products that are simple because they leave things out. He wouldn't just build an accountable care organization, he would build your accountable care organization, where you would get just the amount of care that you need at the right time, at the right place. He doesn't design his products by committee, by deep market research. He goes by listening, by gut, by his instinct, his tenacity, by patience. Healthcare, we get logjam. We have to do everything by committee. There's checklists to follow. Jobs steps back and he looks at his end user. In this case, he would look at the patient and say, how can I make things easier and simpler for them? And he surrounded himself with not just the best people, but the best of the best. 10 times better, the article said. And no wonder there's such innovation. You know, maybe we don't have a provider shortage. Maybe it's a matter of there's too many providers competing with each other in all aspects of care, instead of each one doing what they're best at and coming together in this accountable care organization. So obviously we can't have Steve Jobs leading healthcare, or maybe he would like to help, who knows? We're very insular, and you know, we don't always want to look outside our industry for some tips. But you know what, a couple takeaways, at least in my opinion, is that perhaps we need leaders who have the right to be somewhat dictatorial because they have such a great vision. And if they can impart that vision to employees and then empower them to get it done, things would move faster in healthcare. The second thing is very simple. Talk about an accountable care organization. We as an individual should be our own accountable care organization. We need to take control of our health so we don't need the system, everything I just talked about, at all. Thanks.